Instruction is a part of the educational process. The aim of education is to bring about behavioral changes in the students. In other words, the outcome of instruction is some expected changes in the students. Therefore, instructions tell us what the student will be able to do after they have received the instruction, which they were not able to do before the instruction. Therefore, also it is very important that we define instruction very clearly so that we are able to identify what the student is expected to do. Instructional objective is also called as behavioral objectives. As I have told you, instructional objectives are written in a way that we describe what the student is able to do. Let's take example of today's lesson. In today's lesson, the objectives are to help you to define instructional objectives, to identify the characteristics of instructional objectives, and also to categorize these objectives in cognitive, affective, and psychomotor behavior. Now let us examine the place of objectives in the instructional system. To begin with, we analyze the student's needs. We try to find out the needs through various methods. For example, we try to see the level of students. If the student is in first year, second year, third year, or fourth year, we also try to find out the duration of the class and various other factors such as the methods chosen, the selection of the media, and so on. Now, once the needs are analyzed, we develop the objectives based on these needs. These objectives which we develop help us to develop our lessons. Now, for example, if the objective is to define nursing process, we may select the classroom teaching, lecture, or discussion method. But if the objective is to assess the patient's needs, we may select a clinical method where the patients are there and we can actually demonstrate the assessment of the patient's needs. After we have planned the lessons, then we implement and actually carry out the program, and next we evaluate. So therefore you can see the evaluation is based on the objectives that we develop, and objectives are based on the learning needs, and these together make the instructional system. After we have examined the learning needs, we draw the instructional objectives, because learning needs guide us to develop these objectives. And why do we find out these objectives? These objectives then help us to design the instruction. That means to design the lessons, to design the methods that we want to use for teaching, to select the media. After we have done the designing, then we go into the implementation. That means we do the teaching according to the objective set and the lessons made. And after we have done the implementation, next step is evaluation. This evaluation could be a formative evaluation or a summative evaluation. Therefore, you can see that evaluation is based on the learning needs, which help us to write the instructional objectives, which then helps us to design the instructional plan. We implement the plan and we go back to the evaluation. And this is the cyclic process in which the instructional process goes on. Now let us examine the various steps used in writing instructional objectives. One of the first steps in writing objective is to find the context of learning experience. By context of learning experience, I mean, is it a classroom, or is it a tutorial, is it a clinical experience, or learning contract, or nursing process. Now each of these contexts, our teaching will be different because our instructional objectives will be different. For example, if it is a classroom, we often take objectives which are like to define, to explain, to discuss. For example, for today's lesson, it is a classroom and it is to define and categorize the instructional objectives. Suppose our objective is to observe pulse or to count pulse. We may select a laboratory for it. Suppose our objective is to help students to assess the nursing needs of the patient. We can't have it in the classroom, nor in the nursing lab. We would like to take the clinical experience, that is clinical field for this particular experience. Sometimes our teaching involves developing instructional objectives in consultation with the students. That is, teacher and students together make the objectives. Like in tutorials, if the students have difficulties in certain areas, then the teacher and the students get together and they say that this is the area we want to have more experience. So suppose our objective here is that the students would like to learn better about measurement of blood pressure, and so they set the objectives is to measure the blood pressure accurately. And so therefore in that case our setting the learning context here will be tutorials, and where they learn how to measure accurately both systolic and diastolic pressure. Suppose our objective here is in the context of learning contract. In learning contract, the students take the main part. It is a student-centered learning, and the student takes the main part in terms of what they want to learn. And so therefore the student may say that I would like to learn to observe, say, blood pressure accurately, and or maybe to give oral medication in a way that I can give it to the right patient, right time, at the right dose, through the right route. So therefore you can see that the instructional objectives depend on the context of learning experience. The second step in writing instructional objective is to find out what are the characteristics of writing instructional objectives. One of the characteristics is to find out the description of the learner. Now the learner could be the student, learner could be patient, learner could be a group of people. For example, if I say the student will define breathing process, now here the learner is the student. Or if I say the antenatal primigravida women will perform exercises, here this is a group. Or if I say that the diabetic mellitus patients will demonstrate how to do urine test, that will be a patient. So the first of all, to write an instructional objectives, we have to know who is the learner. And so the objectives and the context of the objectives will depend on who the learner is. And our second characteristics here is to find out the intended learning outcome. The intended learning outcome is the behavior. And this behavior is written in the form of an action verb. Action verbs are those verbs which expresses to do something. Like, for example, to do, to explain, to describe, to identify, to locate, to solve. These are action verbs. So if I say that the students will learn the anatomy of the heart, and if I say the students will identify the anatomy of 4 chambers of the heart, you can see here to learn is not observable and measurable. because the verb learn is open to many interpretations. It's not specific. Whereas if I say the students will identify the four chambers of the heart, it's very specific. You exactly know how to evaluate it, that whether the student is able to identify or not identify. Therefore, the verb identify is a very specific verb. This is called action verb. And instructional objectives are written with action verbs which expresses the intended learning outcome. Now, sometimes we use very common verbs, but they are wrongly used. For example, if you say the students will understand the anatomy of heart, or if you say the students will comprehend the psychology of mind. Now, these verbs are commonly used, but these verbs are wrong verbs. Now, look at this following statements. Which of these statements has used the behavioral terms? Now, suppose we say the students will learn about patient's breathing. And if I say the students will count the patient's respiration, you can see you cannot observe or measure learning, whereas you can observe and measure counting. So therefore, the count is the right word that we can use. Take another example. The students will explain the scientific principles involved in skin traction. Or you say, the students will know the scientific principles of skin traction. Which one would you say is stated in behavioral term? Yes, the word students will explain is in behavioral term, whereas students will know is not a behavioral term. The third characteristics in writing instructional objectives is specification of condition under which these objectives are demonstrated. Now, these conditions could be answering to what, when, where, or how. For example, if we say the students will demonstrate bed making within 5 minutes. Now, in this case, 5 minutes is the time limit. Suppose we say the students will give the injection correctly. Here, accuracy is the time limit. Suppose we say that students will identify the 3 out of 10 symptoms of signs and symptoms of anemia. And here, in this case, is the minimum response you have set is 3 out of 10. Now, these are the conditions of writing instructional objectives. Consider the following example. During the clinical experience, the first-year students will demonstrate bed making using the principles of body mechanics. Here, the how question comes in is that they will be demonstrating it by using the principles of body mechanics. This is the condition. In the same example, you find that while they are in clinical practice area, they will demonstrate this. So therefore, the when part of the description comes in here, that when they are in clinical field, they will practice this. So let us take some of the other examples. Suppose I say that students will take history of the patient by using principles of communication. Now, in this case, if you have underlined the principles of communication, that becomes the condition under which you are expecting them to take the patient's history. The fourth area is that we set a standard in writing instructional objectives. These standards are like criteria that against which you evaluate in this area. Now, for example, if we say that students will make the open bed in 5 minutes. In this case, the time limit standard is 5 minutes. Let's take another example with regard to standards. If we say the patient will walk the length of the hall 3 times a day. Now in this case, what is the standard? Walk length of the hall and 3 times a day. So anyone can say that the standard is that the patient is able to walk the length of the hall 3 times a day. Now so far, what we have taken is 4 characteristics of writing instructional objectives. The first one was description of learner. Second was the description of the intended behavior. Third we took is the condition under which this learning has to take place. And the fourth, or lastly, it is the standards we set to evaluate this learning objective. Having identified the characteristics of instructional objectives, let us look at the classification of these objectives. The behavior can be classified as cognitive, affective, and psychomotor behavior, and so is the instructional objectives. These are also categorized into cognitive, affective, and psychomotor domain. The cognitive domain is concerned with intellectual skill, and these are knowledge, application, analysis, synthesis, evaluation, whereas the affective domain deals with emotion, feelings, and the psychomotor domain deals with the motor skill. It is important to note that cognitive, affective, and psychomotor domain have hierarchical order. For example, it requires more complex cognitive skill to apply or to synthesize than it does to memorize, which is a simple skill. The examples of hierarchical steps in cognitive domain shows that it can involve simple behavior such as knowledge comprehension and can be complex also. Complex behavior can be application, analysis, synthesis, or evaluations. Similarly, the hierarchical steps in affective domain shows that the objectives can involve simple to complex behavior from receiving, responding, valuing, organizing, and characterizing. Psychomotor domain also has hierarchical steps, and these may involve very simple behavior of perception to a very complex behavior of origination. So let us look one by one into each of these domains. First is the cognitive domain. Note the examples of action verbs used at different levels. For example, for different steps of cognitive domain, the verbs used for knowledge are count, define, draw, list, underline. Verbs used for comprehension are describe, discuss, explain, identify, and locate. Verbs used for application are apply, calculate, demonstrate, examine, and solve. Verbs used for analysis are arrange, analyze, appraise, categorize, compare, and differentiate. Verbs used for synthesis are compare, construct, manage, organize, and plan. For evaluation, the verbs that can be used are assess, criticize, estimate, and evaluate. In the area of affective domain, the verbs that can be used for receiving, which refers to being aware of phenomena, are accept, attend, receive, recognize. Verbs that can be used for responding, which refers to complying with a suggestion, could be comply, cooperate, discuss, respond. Verbs that can be used for valuing, which refers to accepting a value as a belief, which can be pursue, seek, defend, prefer. Verbs that can be used for organizing, which refers to organizing a value system, are discriminate, display, judge. Lastly, in the highest level of affective domain is characterization. This refers to internalization and verifying. But in formal instruction, usually we do not include this level because this is an internalized behavior in the person. The next is the psychomotor domain. In the psychomotor domain, the first level is perception, which refers to hear, to smell, taste, distinguish. The second refers to set, and the set is like adjust, approach, locate, place, prepare. In this, it means being ready for response through a mental, physical, and emotional set. Next is guided response. The verbs that are referred are like copy, determine, duplicate, imitate, repeat. And this refers to the imitating the performance. The next comes the mechanism. In the mechanism, the verbs that are included are adjust, illustrate, mix, manipulate, and set up. And the mechanism refers to responding to the demands of a situation and giving a degree of proficiency. The next comes adaptation. The verb that refers to adaptation are adapt, change, develop, and supply. And lastly, what we have is origination, where the verbs come are a very complex behavior of origination. In the end, let us test your knowledge of instructional objectives written in the 3 domains of human behavior. Let's take the first one. List the factors controlling the blood pressure. Where will you place this objective? Yes, it is belong to cognitive domain. Suppose you say, explain the nursing process. Yes, it is also a cognitive behavior, and you will place it in cognitive domain. Suppose we take another objective. The student will prefer to support the patient's their human rights. Yes, the word prefer is written to explain affective domain objectives. So you will call it an affective domain objective. Suppose you say the students will operate the respirator. Where will you put this? This is a psychomotor domain because it is to operate. Suppose you say the students will draw the picture of the heart. It is a psychomotor domain because drawing is a manipulative psychomotor behavior. Suppose I say the students will defend the human rights of the patient. In this case, to defend is what type of domain? Yes, it is an affective type of domain, and because here it expresses the student's valuing system. Suppose you say the staff nurse prefers to do bedside practice than teaching. Again, this indicating preference is a valuing, and so this is an affective domain. Student demonstrate mouthwash. What type of domain is this? Yes, it is a psychomotor domain. Student defines breathing. Yes, it is a domain from cognitive area. So you find that the objectives, instructional objectives, must be spread out in each of these domains. So that gives a chance to the students to have the experience in depth and breadth about the subject matter they are going to learn. So it's important to write the instructional objectives in a way that indicates the 4 characteristics as well as the 3 domains that we have discussed in this lesson.